overall, the current situation in the United States is that most people are not at immediate risk of being exposed to the virus, and it's not currently widespread. The people who are at the elevated risk for exposure would be people who are in places where we do have ongoing spread that has been reported, healthcare workers who are taking care of patients with COVID-19, as well as household contacts and people who've had close contact with those persons. And then, of course, travelers from affected international locations, not just China, where there has been documented community spread. So at this point in time in Arkansas, we are operating under what we call a containment strategy. We are working to prevent this virus from entering into community transmission in Arkansas. So persons who need to be quarantined for having been exposed, or if we identify the case, to isolate them properly and quarantine their close contacts to keep it from spreading in the communities as long as possible.
I will have people coming into my pharmacy that will be saying, oh my gosh, I think I have coronavirus. And I need to know how to instruct my pharmacies to handle these people. And I think that, obviously, anybody who has traveled to an area where there is community spread, we can prompt and ask those questions. But for somebody who has traveled somewhere or has potentially been exposed, where do I need to send those people?
If they don't need to be seen because of the level of their illness, the best thing would be for them to go home, call their healthcare provider, and have them talk to them on the phone and assess their level of risk and whether that might be a possibility, and then coordinate whether they need to come in for an office visit.
I would encourage you to contact your healthcare coalition leaders, because there are caches of equipment that have been purchased in the past that's available from that standpoint. We do have resources such as the Strategic National Stockpile, but that is not, as of this moment, that has not been deployed as a resource for materials as of yet. So I would encourage you first to go there and see if there's things that are available.
Places where patients come, if you need to make sure that you're arming your personnel with adequate hand hygiene, any kind of disinfectant, and pay attention to those high touch, particularly in your department probably would be the keyboard and the countertop where patients particularly may be seen. But just a constant reminder to everyone to wash your hands, sanitize your hands, keep your hands away from your face unless you've just cleaned your hands. Those kind of take-home reminders outside of COVID-19 will protect us against a lot of other respiratory viruses. So use this as an opportunity to make those reminders be known and heard.
Does the hospital right now have a plan in place if you're, the go-to hospital for people with the coronavirus? Are you guys going to section off an area? I know she said you want to assign certain medical personnel to caring for those patients, but currently, do you guys have a plan in place?
While at UAMS we have a very robust infection prevention department, and some of the larger metro hospitals do, we realize that some of the smaller facilities may not have those resources. And I know that from UAMS standpoint, we certainly are open to those phone calls, but there are some great resources on the CDC and our Association for Infection Control, which is abic.org, that have lovely, well thought out, step-by-step plans for pandemic preparedness. Because as you're trying to mitigate where you're going to put a patient, there are a whole lot of other things that you need to be considering as well. So I just encourage some of those smaller facilities to reach out, ask questions, follow those guidelines almost to the letter, and you'll have a good plan in place for your facility.